Absolutely. So we're going to jump right into our first question. And our first question today is, assuming that a vendor has a viable solution to solve a challenge for a larger healthcare organization, besides coming up with the solution itself, what other steps should a vendor take to assure that it is best in class? What do you got?
Hey, Rebecca, this is Gary from Command Direct. I think the way we usually start by giving ourselves a, the differentiator between our competitors is by showing the certifications we have. Data sensitivity is so critical, and being able to provide your prospects and clients with the comfort level that their data is secured and that you have the policies and procedures in place. Those are usually where we start, and it's become less of a requirement as much as it is it's a sales opportunity to be able to showcase the difference between you and your competitors. So I think the certifications, the high trust, the SOC 2, all things around HIPAA, and our affiliations with certain organizations, I think that's where, from Command's perspective, that's usually where we begin.
To add on to that point, Gary, I think also not just the certifications, and I think the other low-hanging fruit, and when Justin Fraser from MCRA, we're a consulting group in the healthcare space, but I think one of the things is demonstrating a return on investment. If you have the best solution and the best technology, it can be very attractive speaking about it in itself, but so many times I've seen clients come to their vendors, or vendors come to their potential strategic partners, and they don't have demonstrative proof that their solution or their service offering is going to actually result in cost savings for the organization. They would tell that story anecdotally. Oh, if you have this, we believe less people will go to the hospital and therefore less on emergency. But unless you have that piece of paper that has the statistics and shows the numbers and analysis was done, I don't think you're going to get very far past that initial meeting.
Hi, this is Eric from Radius Care. Justin, to add to that, what we're seeing is not only do you have to have proof of ROI, but many of the prospects and clients that we're talking to want us to take risk, at least fee risk, right? So if you truly believe that your product generates a 5-to-1 ROI, put your money where your mouth is. So we're in the process of exploring those types of arrangements.
Derek, when you go, oh, I'm sorry. I was just
no, go ahead.
I was going to ask Derek, do you know what risk you're willing to take, and do you disclose that at the beginning of the meeting, or do you wait to see how it goes? Do you put risk at the table right up front? How do you play that?
Yeah, we generally talk about it, but we don't get into details until the opportunity is fleshed out. And then generally what we're willing to do is cut our fees if we don't perform, and then a bonus, some type of bonus if we do. Right, so we're structuring it like an under and over type pricing structure.
Full risk.
Yeah.
This is Cindy from MedWatch, Derek. I couldn't agree with you more. I will tell you all that from MedWatch's perspective, I don't typically go in and offer any type of risk arrangements, because most of our programs and the success of our programs are so dependent on member participation. And so the plan has to have some meat in the plan summary document or somewhere to make sure that if we're going to go at risk, we're going to get the members to participate. And then we always will say, if we go at risk, if we blow by those numbers and perform better, like you said, Derek, we want a bonus. And interestingly, what I find is when we start talking about that end of if we outperform and we do much better, we get a bonus, then usually the going at risk discussions, at least for my services at MedWatch, sort of goes away. And
I know for Recovery Audit Solutions, for us, we service across the board, commercial, Medicare, Medicaid. But what's primarily a focus for us is outside of the ROI, totally agree with that, is our accuracy rate. We are currently running at a 98.9% uncontested accuracy rate, which is somewhat unheard of for reviews that we perform on behalf of our clients. And in addition to that, it also allows the client to understand that we're very focused on provider abrasion. Because if you're auditing and you're providing a service to your client, they are very much focused on the abrasion of the impact to the provider.
Yeah,
good point. Because if you save money and you blow up your network and you kill it, then your saving money becomes diminished. It's not as good a goal.
Doesn't make anybody happy.
No, I totally agree with everything that's been said. I mean, I think the best way to ensure that the customer is going to get what they want is to offer them a guarantee. If you can't offer them a full guarantee, like a full risk type of situation, then at least offer them something like a satisfaction guarantee. But I think, like has been said, if you're going to participate in the downside risk, you need to be able to participate in the upside too. If you blow past your numbers and you do exceptionally well, there should be potentially some bonus. You should go both ways. I think, and for us, we don't really provide, I'm Mike Vincent from Get Set Up, by the way, and we don't really provide medical services or anything that are, clinical types of services to save medical costs. But what we can do is help improve things like member satisfaction and, adherence to different types of gap closure and other types of things plans want to do. So, a way to do that is to do surveys. Do a survey, at the beginning of a program, and then survey the members at the end of a pilot, and show that improvement in satisfaction and adherence to care protocols and things like that. So there are ways you can still guarantee satisfaction without taking full risk. Anyway.